COVID virus may disrupt fat cells leading to diabetes, study finds. When someone connects COVID-19 to diabetes, the typical result is diabetes serves as a risk factor for severe disease. But is it always like that? According to a new study, the coronavirus seems capable of leading patients to diabetes. Findings showed that the virus is doing more than just infecting fat cells. On November 16, 2020, a 57-year-old pharmacy technician from Idaho contracted COVID-19. Like most COVID patients, they developed iconic signs like loss of taste and smell, fatigue, headache, and body pain. While the headache and muscle spasm disappeared a month later, the sense of smell and taste hasn't fully returned. On top of that, they experienced something not a typical red flag of COVID-19. I noticed that I was so thirsty all the time, and I just thought that was part of the COVID. I was drinking gallons of water, said Nola Sullivan, as per Science News. As a pharmacy technician, she knows that thirst can indicate a chronic illness, diabetes. She decided to check her blood sugar to rule it out. A person who is diabetic usually has blood sugar levels of 200 milligrams of glucose per deciliter of blood or higher. Sullivan's glucose level was over 500 milligrams. A study published in the journal Cell Metabolism showed that in over 3,800 COVID-19 patients, 49.7% developed high blood sugar levels, the same as Sullivan. These individuals were not diabetics to begin with, which puzzled researchers as to why they ended up like that. Of more than 3,800 patients, 91.1% of those intubated and 72.8% who died from the disease had high blood sugar. The study was motivated when many COVID-19 patients who had normal blood sugar would end up with high blood sugar. Sure, diabetes may occur to anyone at any age, no exception if you're in your 20s. What's odd is that these patients had normal glucose range who would suddenly get spiked after contracting COVID-19. Sometimes, their high glucose was more than 2 times what a diabetic would have. Although the mystery is largely unsolved, the study detected that the high blood sugar in those patients was made of high levels of C-peptide. It indicates that the pancreas is producing insulin, but for some reason, the sugar levels are skyrocketing. Researchers suggest that the coronavirus is messing up with fat cells. The patients had low levels of the fat cell hormone adiponectin, which is responsible for other cells to obey insulin. Thus, COVID-19 patients who developed high blood sugar during infection might have insulin resistance. However, the resistance was not due to poor insulin production, but because of low adiponectin levels. What's your take on this study? Do you agree that the coronavirus may also put someone at risk of diabetes? Share your thoughts in the comment section. Till our next video, thanks for watching.